Welcome to Expert35. I'm your host, Gabriel Garcia, and as promised, expert from 35 different industries, talking about the challenges, the opportunities, and the hardship. And today we're going to talk about opportunities. We're going to talk about nutrition. And Kim just joined us. This is great because we were not going to introduce Kim right at the beginning because she was trying to jump in. But let me see if we can get her on the air. We can't see her video yet. So we're having a little bit of technical problems, but she changes her resolution. Kim should be joining us with Advocates for the Independent. She talks about senior living, senior care. And Shana, thank you for joining us again. Both of you guys are OG experts. You're going to be talking about nutrition today.
That's right. So I'm happy to be here. Thank you so much, Gabriel, for the opportunity.
And Kim, you are on the air, but we can't see your video yet. So maybe change the settings. But if you can chime in as soon as you can hear us, that'd be great. We'll continue talking about, man, the environment is just so challenging because the stress, because everybody's at home, because our eating habits have been different. So, what can we do, Shauna, to really, get on the right page?
Well, I think it's been especially hard on our older adults. We have been seeing rising rates of anxiety and depression, but we need to look at ways to support not only that population, but also the caregivers who provide so much love and support for the older population. Some of the things that we want to make sure that we're supporting them with is a really good nutrient-dense diet. And those things would be, when we think about a healthy plate, are going to be filling the plate with about half the plate of vegetables, non-starchy vegetables, making sure we get good protein, because oftentimes our older adults are lacking protein for a variety of reasons. It could be food insecurity or lack of transportation, and then also just malabsorption issues. Over time, our stomach acid decreases and our ability to digest proteins can diminish. So making sure we get adequate protein is important. And then also making sure that we get adequate water. Oftentimes people who have limited mobility are afraid to get up and down throughout the day to go to the restroom, and so they'll withhold their water intake. And when that happens, we can become dehydrated. Our medications the efficacy of those medications may be reduced, and then it might lead to urinary tract infections, which then causes its own cascade of problems. So looking at this healthy plate version that Gabriel's posted is a good reminder for us what to help them with.
Perfect, and we got Kim. Kim, we can see. We can see her. She's going to change her resolution, but like we said, Kim has a ton of experience with Advocates for the Independents. And Kim, if you can change your resolution, because it looks pretty. I'm going to hide the video for a second. There you go. Oh, she's in, and we should be able to hear you now. We can hear you now.
Finally.
Kim, tell us about taking care of the elderly in nutrition, because that's such your area of expertise. She may have frozen up on us. We're going to give her a second to see if she can pop in. And then just so we talk a little bit about her, where she comes from. It's Advocates for the Independents. It's long-term caregivers. And one of the things we were talking about offline was how important
Shana,
it is
to and maybe try to do this at another time.
We can hear you now.
Okay. I didn't hear the question. I'm sorry.
Oh, tell us a little bit about the stress and what caregivers can do to help the elderly right now.
One of the things we can do is we can make meals for them, make sure exercise, but more and all, make sure they're drinking fluids and getting the nutrition that they need. And that is something Shana helps us with also and gives us information on the correct nutrition and the right protein and the amount of foods that our clients need.
And Shana, you guys work together. How does that help providing that proper nutrition to the elderly?
Sure. So when Kim talks about adequate protein for patients, sometimes making it clear for the caregivers that certain foods and things that they might be getting at the store may actually not be in support of that older person. We want to make sure that they are getting adequate protein, and some easy things to have around are canned tuna, canned chicken. Sardines are loaded with minerals and great omega fatty acids. Beans like chickpeas or black beans, those are all some easy pantry items to have at home. But when you start to look at, full meals, I want to just remind you that our grocery stores have a lot of really good prepared meals that can also provide nutrition. At HEB, we have these chicken that's cooked, white and dark meat, that you can add to a salad, add to a soup. It's prepared. It lasts in the refrigerator, around 4 days. That's an excellent thing to do. There's also some other prepared meals that are, like this example, loaded with broccoli, carrots, onions, providing a lot of phytonutrients, and chicken. And these just go in the microwave. And a new one that I just found this week, a patient turned me on to this, is this Kevin's. And they have about 6 or 7 different varieties. But this is a serving for 3. It's $9.99 in the grocery, but it's tasty. It meets protein requirements. It has 23 grams of protein per serving, which is important as we talked about maintaining good protein levels in the body for our older adults. So finding these easy ways so that the caregiver is not burdened with cooking all day long, but they are also supporting their older adult with some good nutrition.
Great input. And we've got Kim. I know, Kim, you're struggling coming in and out, but wanted to give you, one of the things that we love about our show is 3 things to do now, specifically with elderly care. Can you tell us what 3 things you suggest people do?
Well, if they're very stressed out, which a lot of people are with, just in normal times, not in the COVID times, people are still stressed, but it's worse now because people are having to homeschool, and they're also now worried about their parents. They're trying to make sure they're, being taken care of. One of the things is, I said, make sure they're getting nutrition and not buying the regular old frozen meals. There's too much sodium. They're not that nutritious. And get help. If you might want to get help, if you don't always have to hire somebody, you can ask friends, other family members to help you take some of the
It's so true. Thank you so much, Kim. I know you're coming in and out. I know your internet connection is tough,
sizing
but
to stay
thank you so much
healthy.
for the ideas. Let me see. So again, we're going to let you go because I know the connection's really challenging. We'll put your notes on there. We'll put links to your resources because we know you have great resources on Facebook, and I'll let you go on the chat because I guess you can't actually answer some of the questions about health. But stay safe. Hope your internet connection comes back a little better on this next round. Thank you for joining us. All right. That was Kim from Advocates of the Independent. And it's super challenging sometimes. Obviously, we're live and we can't always count on the best internet. But, kind of go with that, Shana. You heard some of the things that they're going through is, definitely like ask for help, avoid the frozen meals, and just lower that stress level, right? What do you have in terms of facilitating that process? Because, we're down to homeschooling. You've got so many more things on the table that, those frozen meals sound like a great idea, right?
Yeah, they do, but they, just like she said, it can, some of them can be high in sodium. These prepared foods that I showed are all fresh, and so they don't need as much preservation from sodium. So you can read on the label, it'll always tell you what the amount of milligrams in sodium.
Hmm.
Generally, our older population wants to stay under 2,300 milligrams per day. And as I
Hmm.
mentioned earlier, if your sodium content is high and you're dehydrated, that's going to cause some health problems. And we know that about 45% of our older population have chronic disease, two or more comorbidities, we call it.
Hmm.
And so being able to manage that, as well as all of the prescription medications that they may be taking,
Right.
just stress, not only for that older adult, but to the caregivers. So one thing that I often recommend to patients as well as caregivers is really trying to find a mindful practice. Even if it's 5 minutes a day, if you spend time reading the Bible or following specific scriptures or listening to meditative music,
Hmm.
or there's so many great apps for meditation like Calm and Headspace. Even 5 minutes, research is showing that that's going to reduce our cortisol, which is our stress hormone. And
Hmm.
that 5 minutes will shift your body from that stress mode of fight and flight to rest and digest, which is particularly important for our older adults.
So one of the things that I find conflicting information, because what we don't want is we don't want people to just Google this. We want people to like actually find good, resources. But is it better, for stress and for healthy to have a routine or to have, schedules that are that within those times, it's not the same thing every Monday, right? So like maybe on Monday there's an activity, but it's not always the same activity. Like what do you find as being better for a healthy, more active, brain function, and ultimately we want to boost their immune system because of COVID.
Yeah, so I practice personalized nutrition, and so my answer is going to be it really depends on you. If you like a routine and you do well with the schedule, then having that quiet, reflective practice built into your day at the same time is going to be more supportive for you.
Hmm.
However, if you're more spontaneous and you don't, I have some patients who hate eating leftovers. But if they like something new and novel all the time, and they're going to be more apt to do it because it is new and novel, then that is going to be the way to do it. It really
Hmm.
depends on you. The main point is get it in. It makes a big difference.
Yeah, and I think some of the randomness is really good for some people to keep their mind active and not expect the same thing, because with expectation there's also disappointment, right? If things can't happen, especially COVID. Greg's got a great question. What do we do when seniors have trouble getting the proper nutrition when they have digestive issues due to medication or health problems?
So it's important that they are followed by their healthcare provider, whether that's a doctor, a nurse practitioner, a dietitian, but making sure that first of all their intake is quality. But in some cases, there may be interventions that we need to do, like providing digestive enzymes or supporting stomach acid production with foods that are what we call bitters that can help increase enzyme release, increase stomach acid, because we need all of that to really properly break down the protein, the carbohydrates, and the fats.
Great question. We have another question. I can't post it. I'm going to try to see if I can post it. Is there an online ordering sales or tool that can provide nutritious meals that you suggest?
There are some. Caveman Eats is a good whole foods based program that you can order meals. Trifecta is another one that has good whole foods based balanced proteins, balanced fats,
Hmm.
carbohydrates as whole grains like quinoa, millet, brown rice, things that are going to slow down any kind of blood sugar dysregulation that you might have. Those are a few of the good web-based programs.
And we'll totally put those on the chat because I mean I can see it. There's a couple of chats on LinkedIn right now, and that's why I'm trying to like transpose them. People are asking, I'm so busy with the kids, right? It all seems to be centered around this stress to trying to send nutrition. Somebody wants to hear the milligrams. What is the amount of sodium they're trying to stay below?
2,300 milligrams.
2,300.
Lower if you have high blood pressure. Your doctor
Mhm.
may have put you on a DASH diet, dietary assistance to stop hypertension. But we also know that salt's really important. It's one of the major minerals in balancing fluid, in balancing electrolytes, and balancing actually cardiovascular and muscle contraction. So it's important that that's regulated.
Yeah, and I think it's so important to understand how to read the label. In fact, I think we should have a label reading literacy class
That's a great idea.
by you, right? And maybe we invite our customer, all our fans and people from the group, because I think it could be something really important. I know I'm very selective in what I look for, based on some of the nutrition things that I had to go through. And so it would be interesting to say, like, hey, this is what it means, right? And this is why they chop things by serving. I mean, and obviously their goal is to sell it to you. So.
To eat more and more and more of it. So
Mm-hmm.
important to really understand serving size, total fat, total carbohydrate, total protein, and then the ingredient list. It's
Mm-hmm.
listed by what's most in that product. And I say product because it's manufactured generally.
Right.
On our apples or carrots, we don't have a label. But yeah, that'd be a great topic for us to explore next time.
So here's one that's it's a little interesting is what should we avoid? So when they're seeing a product, it was very in line with what you were saying. I would imagine it says, what should we avoid? I think if you're seeing something, you should avoid something. If you're trying to buy strawberries and strawberries isn't the first, product in the list, you should probably avoid that product, right? I mean, if you're trying to eat healthy, I would imagine that if the product that you're looking at in the photo isn't listed in the ingredients, you're probably not getting any, unless it's a vegetable substitute, right? For meat.
And I think for our older adults especially, the aging process generally involves some inflammation.
Mm-hmm.
So that we eat, we want to support and have as an anti-inflammatory base. So if we're eating packaged foods that have more than, really 5 to 10 ingredients, and especially ingredients that you can't pronounce very easily,
Yeah.
then put it back on the shelf. It's not really necessary for you. Things like inflammatory oils, all of the soybean oil, cottonseed oil, canola oil, those
Mm-hmm.
are omega-6 inflammatory properties. And so our older population especially, does not need intake of that.
Now, why do we use it? Is it because it makes us? Does it kick off like a dopamine that makes us feel good about the food? Is that why it's in there, or
Cheap. It's a
cheap?
very cheap ingredient for for the manufacturers to use in the processing.
Mm-hmm.
So corn, wheat are the 3 top crops, in America. They're also the 3 top crops that are sprayed with pesticides. So we want to, when we are having those things in our foods, look for organic. We can't always do that, but when you can, read the label and see what's in your food.
Right. Right. And what are your suggestions about takeout? Right. If you're down to the moment and you're like, hey, what should we avoid in terms of, because from what I understand, at least if it's been cooked, it's got a less chance of it being contaminated if we're trying to avoid COVID, right? And you're trying to avoid other, not just COVID, other diseases being transferred. What do you think would be like the best use of takeout if you're in a bind?
Yeah, so and take advantage of it. Number one, we want to support all of our restaurants right now.
Mm-hmm.
So important to keep that part of our economy going strong. And 2, I think when we do take out, 1, don't stress out that, I didn't fix a meal at home today. So what? You didn't fix a meal. You didn't have time. Whatever your reason, just go with it. Don't beat yourself up about it because you're inviting more stress hormones in that process. But if you do have takeout, then try to avoid fried. Try to avoid things that have a lot of heavy sauces, because as much as our restaurants are looking at doing more clean eating, more local ingredients, they're still using these inflammatory oils in the preparation. So pretty much anywhere we go, we're being exposed to those. But if you have foods that are fried or laden with those big heavy sauces, then oftentimes those are going to have more inflammatory properties.
And that's great advice, right? Like stay safe, take advantage, still support the community. And but sometimes we have to, and sometimes you're in a bind, and it's good to avoid. One of the hardest things for me to avoid was butter. Like everybody uses butter, and the other thing that's really hard to avoid is garlic, right? A lot of people, there are people that are allergic to garlic, and garlic is almost everything.
I know. I have many patients that follow what's called a low FODMAP diet for GI stress. And two of the things we have to avoid are garlic and onions. And that's really the hardest part of the diet, because everything prepared when we eat out is either usually pre-marinated or seasoned with garlic. It's delicious, and when our gut is working great, both of those have really beneficial properties for us. But when we're trying to avoid it, it does make it difficult.
Right. Well, my favorite part of the show, Shana, we always tell people 3 things to do now. So go for it.
So I want to make sure, my older adults, that you're really getting a nutrient-dense plate. When you look at your plate, you see half of the plate filled with non-starchy vegetables, broccoli, cauliflower, green beans, lots of color. That you have 25% of your plate as good, healthy proteins, and then 25% of your plate as those starchier things. So potatoes or brown rice, quinoa, all of those have a lot of good nutrients, vitamins, and minerals. So that's number 1, make sure your plate is good and healthy. 2, for my older adults, and we kind of talked about this a lot, is be sure you're getting good protein every day. Somewhere between around, for women, say 150-pound woman, around 55 to 65 grams of protein a day, and for a male, about 180 pounds, closer to 80, 85 grams of protein. And then lastly, making sure you're hydrated, because so many of our chemical reactions in the body require hydrogen to happen. And if you remember, H2O is 2 molecules of hydrogen. That water is essential. It helps carry nutrients in the cell. It helps with elimination. It helps lubricate our joints, which is something that sometimes as we age, we start to feel some of those symptoms of arthritis and stiffness. So being sure that you are having adequate hydration is very important.
Great points. Great ideas in terms of concepts of nutrition and making it easy and convenient. I love the idea of like, hey, indulge, right? And really remove that stress. We really need to lower our stress. We're going into months of this. I mean, who would have thought 6 months ago we would still be here? I mean, you're one of our first people to come in on the show, just because everybody's going to be like, oh God, we're going to cook at home for the next 4 weeks. And now 25 weeks into it, I don't even know how many. I stopped counting weeks, actually.
But I'd love to hear in the comments if any of the audience has really been cooking at home. What have been your things? What have been your fails? I'd love to know about what's working for you.
That's great. Actually, put it in the comments. Shauna's going to go in there and answer questions that we weren't able to put on the air. But again, so timely. Thank you for being on the air today on the show. And wish Kim could have had a little more impact, but her internet couldn't join us. Didn't participate the way we wish it could. But I really like the concept of, we do have to take care of the elderly, especially now, because as you can see, this isn't escaping anybody. And the stress is a big part. Now, I hadn't even thought about what you were saying in terms of the inflammation and those pieces. So I would totally love to come bring you back for a literacy of the label, because I think, some of us are illiterate in that world, or maybe we choose to not read it because we know we like it. And I think those are both really valuable.
Me too. I'd love to do it. Thank you, Gabriel, for the time today.
Thank you so much, Shana. We'll see you soon.
Okay, bye.
Bye. Guys, that was Shana with she's a registered dietitian, showing us ins and outs of like what is important about our nutrition and what we need to do to stay healthy. Kim also, one of our biggest points was saying to ask for help. It doesn't necessarily mean you need to hire someone. It means like that somebody can actually, sometimes it's as simple as asking your family, your neighbor. Make sure that you get that support, because we want to go through this together, and it is hard, and nutrition is the forefront. And if we don't keep our nutrition properly, our health starts going down, our immune starts going down. It just makes it harder and harder to stay together. So guys, be safe, and keep us informed. If you want to join us, text Expert35.
We collaborate at Expert35. This is for a better tomorrow, and a better today. Let's come together, and together we will find a way. You got questions, we got solutions. You got problems, we got resolutions. Visit Expert35.com. No need to worry, just remain calm.